This is an individual tragedy as well. Autism destroys families, and more importantly, it destroys our greatest resource, which are our children. These are children who should not be suffering like this. These are kids who many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children.
I was just watching that as we prepare for our interview, and it started to have a rage. Okay. That's, of course, Robert Kennedy Jr., the HHS secretary. That was from he did a press conference on Wednesday. So let's start off top. April's Autism Acceptance Month. And that's our nation's top health official rolling back decades of progress in one press conference where he talks about it. Ostensibly, the punchline of this is it was supposed to be a press conference rolling out a report from the CDC from 2022 saying clearly that the number of diagnoses of the autism spectrum have gone up, mostly because of better reporting and getting to under-identified previous groups, minorities, people of color, maybe people of poverty who didn't have a chance to get identified previously. Instead, the HHS secretary basically dismissed the CDC and said it's caused by external factors that occur when somebody turns 2, and he's going to find out the root cause of it by September of this year. And that's what it's basically all the fears we thought we would have to have Robert F. Kennedy Jr. in that position, but more. And of course, there's much more. Let's not forget his very interesting positions on the massive measles outbreak going on right now.
Around that you do believe that the MMR vaccine is the most effective way to limit the spread. Do you believe that Daisy would have died or her cousin would have been sickened if they had had that MMR vaccine, which they did not have for religious exemption reasons?
Well, it's very hard to tell. Daisy, I've seen her medical reports. She had a lot of complications that could have killed her, particularly she had acute tonsillectomy. She had been hospitalized 3 times before. She also had acute mononucleosis that she could not shake. She was graft positive for bacteria in her blood system, which is a red flag, and her death was caused by pneumonia. So, her parents said that she was over measles 2 weeks before, so it's hard to tell. Measles often is accompanied by pulmonary and respiratory illnesses, but we need to do better at treating kids who have this disease and not just saying the only answer is vaccination. We also need to make sure that doctors know the appropriate treatment for those kind of diseases as well.
Okay. Yeah. Keep in mind, he's not a doctor. Okay. He's not a doctor. And this is a massive measles outbreak occurring in a religious community, the Mennonite community in Texas and others, that has gotten a pass on vaccines because of the fact that they get religious exemptions. And now they're paying a price for it as kids die and an epidemic spreads. And the guy in charge of our healthcare is minimizing it. Even as saying, while we were desperately awaiting, researchers were desperately awaiting for the letter to come from the CDC with outlining how they should treat this outbreak. You've got young doctors who have never seen measles in their lives facing emergency room situations to try to take care of kids with a disease that they, in their lifetime, has never presented itself in the ER. That's where we are. And of course, Republicans have got to come out and defend him, of course, because that's what they do. But that didn't go so well last night as Dr. Chris T. Parnell of the NAACP wasn't having it on CNN.
Can't say give someone a benefit of the doubt when we already have proof in Texas that 2 children are dead from a measles outbreak that should not have happened because you have a secretary who has consistently and systematically undermined the science around vaccines. How can we give him a benefit of the doubt when he spent decades being a charlatan charlatan when it has come to science and public health issues. Here is a person during his nomination process who espoused medical racism. He said that Black and African American people had different immune systems. Excuse me, sir, there's no room for a benefit of the doubt. As she was just saying, we have gutted programs at both the CDC and the FDA around smoking. Do you know the leading preventable cause of death in the United States? Tobacco. And you gut the very opposite.
He's not going anywhere. He's there.
Oh, he's there. He's not going anywhere. So fuck it. Let people die. That's really the attitude of the clowns they put on CNN to represent the Republican Party. We got to give him the benefit of the doubt. Well, we don't. And as always, I have the perfect guest to talk about this, as they tend to like just fall in my lap. So I'm very, very fortunate to have an expert and an actual physician who can talk about these things. Let's get on with the show. I am Fred Wellman, host of On Democracy, the FPL, right here on the MeidasTouch Network on our Substack. It's so great to see you guys again this week. We got a lot to talk about. Let's get on with the show. Oh, welcome, welcome, welcome. I am still Fred Wellman, host of On Democracy. Yeah, I mean, if your blood's not boiling, I don't know what to tell you. Sorry to get you going on a late Friday night, but that's the situation we face as this denial, what I'm starting to call a second dark ages that comes to the United States of America, as science is shit upon and forgotten. So I got the perfect guest. As I mentioned, Dr. Rob Davidson is the executive director of the Committee to Protect Healthcare, co-host of the Paging America podcast. He's also an ER physician in Western Michigan. Dr. Davidson, welcome to the show. It's great to see you, Doc.
Thanks, Fred. Good to be here. You know, my coffee was wearing off, and I worked till pretty late last night. But that little intro kind of got my heart rate up again. So let's go.
I know.
Yeah.
I mean, it's funny for those who are in the system here. You know, I can see Dr. Davidson or Rob off stage, and as those videos are playing, we're both back there going, you know, it's gotta be. I told you in the pre-show, I ran a COVID field hospital in New York during the first Trump administration, and I knew. I remember looking at our physicians there as I was literally in a physicians meeting when he did his press conference, talking about maybe we could use the bleach or the lights could kill it, and watching the professionals just shake their head. I imagine you're facing a similar situation in your ER right now, aren't you?
I am, but the one that got me that Trump said was when he talked about doctors and nurses running into COVID rooms like soldiers running into bullets, and I'm like, what the hell are we trying to do here? Are we trying to sacrifice this? But yeah, I mean, listening to and hearing and kind of taking in all that RFK Jr. is saying and doing, it's tough, right? It's tough being a person doing this for 25 plus years, being actually trained in medicine and the scientific method. I mean, we'll give some hope. The people actually taking care of patients. My wife's a doc. I'm a doc. People I work with, and nurses. We're still doing normal medicine, right? We're
Like
still
the thing, yeah.
talking to our patients the way
That's
about
good.
actual, disease processes, how to prevent disease, how to treat disease. So there is hope. But man, the person in charge of the whole system, it's terrifying. It's terrifying.
I can imagine. Of course, you are the executive director of the Committee to Protect Healthcare. You guys put up a hell of a fight, thousands of letters and signatures and petitions trying to get him stopped. You came close, I believe, in stopping him from being approved. So you've been in the RFK Jr. fight for a couple of days.
Yeah, we had over 22,000 physicians around the country sign on to a national letter opposing him, for the reasons, vaccines and his doubting HIV causes AIDS, his as the physician on CNN said, medical racism and his claiming antidepressants cause school shootings. I mean, go down the list, and certainly vaccines are near the top, and we're seeing it unfold in Texas. And he's pouring fuel on the fire by denying the root cause of this outbreak in Texas, and by somehow touting treatments that don't exist and causes of death that are not, the cause of death. The root cause is pneumonia, is measles. Measles causes pneumonia. Measles attacks your immune system, allows you to get bacteria in your blood, allows you to get mono, allows you to get sick from other things. It all goes together. And treatment for us, you don't have to know how to treat measles because it's honestly supportive. You hang on for dear life. You do everything you can to support all the systems of these kids and hope that they can rally and come around. And fortunately, most have, but tragically now a couple have not. And it didn't have to happen. And it doesn't
No,
have to keep happening, and it will.
And it doesn't, and they're still kinda resisting the idea of the MR vaccine and the lies that go with that, and we're seeing this thing spread. I mean, how far is this measles outbreak spread now?
Yeah, it's hard to say. I mean, how many cases are there now? Nearly 500, I think,
Yeah.
in Texas and across other states. We just had our first case in Michigan for one or two cases this year pop up, and it's almost completely in people unimmunized or who maybe had one dose of vaccine. Now the schedule is
Right.
two doses of vaccine, and with two doses, you're 99% protected, and it's a protection that lasts like in perpetuity, basically. They don't know.
Right.
It keeps lasting. And it's another thing he's saying. He's saying, oh, the immunity wanes. I mean, it isn't only that he's espousing weird ideas or controversial ideas. He's just saying things, and maybe it's par for the course for this administration that are the exact opposite of true. It's not partial truth or half lie or anything. It is just 180 degrees from true. One of the most lasting vaccines we have is measles, and he's saying it doesn't. I don't know how he gets away with it.
It is
Right?
shocking.
We're here
I
talking
mean,
about it, and
yeah, we were talking about it. I mean, and he's way above his head. And at some point, I mean, that's the thing is, I think we talked about the economy. I talked about tariffs last week. The craziness. But in the end, this is people's lives. We're talking about life and death situations. The decisions that HHS makes and the things he puts out will put lives in danger. At some point, I hate saying it, I almost said it out loud. Bodies will stack up against that attitude of a former soldier and then former COVID field hospital guy. These are dangerous things. People, we're going to lose lives, aren't we? No, it's not.
hyperbole. I mean, you can say it. You can't be afraid to say what's true. Um,
Yeah.
and beyond, I mean, the ridiculous stance he has on public health, on vaccines, certainly on autism. We should get to that. But
Yeah.
his was that agency handles Medicare, Medicaid. The CMS, they got Dr. Oz there in charge,
Yeah.
who is a guy who profited off of privatized Medicare, so-called Medicare Advantage, but really privatized Medicare. Right? They've already privatized Medicare. More than half the seniors are on it. It costs 20% more for taxpayers. And when people get sick, they get completely screwed. They get left out in the cold, and they end up paying big bills. That is what this agency does. I mean, I can't think of it's Brett. I have a bias. I'm a doc. I'm a healthcare advocate.
I
So
accept that.
HHS is to me like the cream of the crop. That's not one of those throwaway cabinet posts you give to a donor who gave a lot of money or someone who endorsed you, which is what this looks like. You need someone who knows what the hell they're doing. And so even if you give him the benefit of the doubt and just say he's just ignorant and over his head, it's a travesty. He should not be there.
Right.
That doesn't seem to be the case with RFK. I mean, this guy's profited off of suing, for based on his anti-vax stance. He started the Children's Health Defense Fund that's made, millions off of kind of preying on families that are just devastated by a diagnosis that can be devastating in many families, even mild on the spectrum. It's a challenge for families, for individuals, and he's preyed on that, and it's
Yeah.
cruel. I don't know. I don't know how the guy sleeps at night. Hopefully he doesn't.
I don't either. And let's turn to that discussion of autism. I said it's April is autism acceptance month. It is hard. I do have a family member who we used to be they called Asperger's, so which is now of course on the autism spectrum, and there are challenges raising someone with that situation, and they have enough challenges. It's enough challenges not to make it a stigma. And he just turned right around and did that. It is, I mean, the things he said were so. I mean, there were. I had to take my glass off because people who watch the show know when I take my glass off means I'm like, like by rubbing my eyes because my anger, and they're gonna come off a lot in this show. I can tell because that's just he's re-stigmatized. And for me, uh, it's the next step is we should just put them somewhere, right? Well, they're a burden on their families. They'll never pay taxes or work. They can't even go to the bathroom alone. And then
Right.
for me, and you and I are old enough to remember probably when they're well, we should just put them somewhere, right? Like a special bus.
Yeah.
You know what I mean? And it's just it's that step. I mean, what do you think as you watch that conference unfold?
I mean, it's abhorrent, like it's beyond cruel, because it is cruel to the individuals and their families to
Yeah.
put them in a category of other or less than or kind of,
Right.
people who can't fully participate in society, and many people on the spectrum can fully participate in society.
Definitely.
We have people that are on the autism spectrum that are some of the most accomplished people in their fields. If you look back in history, we can't make diagnoses of these historical figures, but people look at folks like Mozart. Look at I was looking at a list today, a reputable source, and people said Einstein like didn't speak
Yeah.
till he was like 4 years old, and hyper focused on physics and math, and groundbreaking in those fields, but did not excel in other parts of life and interactions with other humans. I mean, that sounds very much like what we called Asperger's, what's now, on that spectrum. Sounds
Yeah.
very familiar.
Sure
That's
does to me. I know.
like if where would we be, without some of those groundbreaking folks in those fields? Yeah, so it's cruel. And the piece of that also that really jumped out at me is the first thing he said wasn't about like social interactions and so general life and playing baseball. It was won't ever pay taxes. Like where
Whatever.
people's priorities,
I mean,
you know?
yeah.
Like
What does that mean? Yeah, it's like
Yes.
okay. It was shocking. I mean, watching the whole thing unfold as he just kind of whipped it out, and there's been a massive backlash. As I was getting ready for the show today, it's like, holy cow! I mean, Holly Pete, I mean, the people who are, I mean, people like me are just like, are you freaking kidding me? It's like,
Yeah.
it's like, I love my kids, I love my, that are struggling with this. There's no difference in that, and you're right, they are brilliant, and you do know when you have them, but to say they're not worth society, that they're basically refuse or a
Yeah.
burden on society. And then that's before we get to the science, right? Let's get to the science part. This idea that suddenly at 2, something happens, right? And that's not how
Yeah.
that's not how it progresses at all for those of us who've raised kids. I
Right.
mean, you know that, right? It's not a sudden thing at 2, is it?
Right. No, people notice, right, very early on with your error. Oh, you have an infant and they're vocalizing and they're interacting with you, making eye contact and smiling or laughing or reacting to your facial expressions, your behaviors. People report their children who eventually are diagnosed on the spectrum didn't do those things to the extent maybe that other kids did or
Right.
other people's kids did. And often it's like in retrospect, you recognize, oh, okay, yeah, that was something that was happening that maybe at the time I didn't recognize or notice, or if it's your first child, you just didn't know it was different.
Especially your first
But
child.
then, yeah, at age 3 or so, when it's clear when they're maybe less verbal or nonverbal or having more difficulty interacting, and they actually get diagnosed, and you can all look back and say, "Oh, okay, that makes sense." And this,
Yeah.
again, you said this press conference was ostensibly to announce that the CDC had said, the rates are up, but largely they're up because we are diagnosing it more, right? We are diagnosing it better. We have diagnostic criteria that people are following, groups of people who previously maybe weren't diagnosed. And it's important to get diagnosed if you are, because you can get IEPs at school, right? You can have assigned
Yes.
for testing. You can have extra
Yes.
accommodations for all that, and be able to thrive and succeed. Whereby
Yes.
in in the good old days, they're all trying to go back to, right, the 1950s, making America great. You didn't. You just stuck those kids in a separate school, in a separate classroom, and just didn't deal with them because they were too hard to deal with. That seems to be kind of where they want to go. And again, it all just goes together, right? Making the false
So
claims that vaccines cause them, which they don't. Making the false claims that it's this epidemic that has to be from an environmental cause, when in fact it's from other diseases are the same way. We diagnose more heart attacks today than we did when I first started practicing.
right.
So we have a blood test called high sensitivity troponin that we didn't have before, and we pick up very small heart attacks that we didn't used to pick up. It isn't that more people are having them. Maybe some are, maybe some aren't. But the vast majority, it's because the test and the tool. Trump did this with COVID. Don't you remember
Right.
famously with
Oh yeah.
cruise ship? Oh, don't let the
Mhm.
cruise ship land. If we test more people, we'll have more disease. I prefer
Stop
not to
testing.
test, then we don't have
Stop testing. That's it.
like
Stop testing.
people. This is not
Well, it goes to everything.
concept.
No, it's not, and
Yeah.
it's not novel to any one disease or one spectrum. I'm
No.
I've got PTSD. Look, when I joined the army, when I was a young officer, we talk about PTSD,
No.
and
No.
and when I remember talking to my father when I got back from Iraq, and I figured out pretty quickly there were some issues. I lost 2 men very brutally, and I remember talking to my dad. He goes, "Yeah, I had an uncle when he was World War I vet, and he just went, he was crazy. He just kept to himself." Yeah, I'm like,
Yeah.
he was a drunk. I'm like, he might have had PTSD, Dad. Like,
Right.
no, just a little shell shock. That's what it is.
Right.
It's not. So that's why it was interesting. There's a woman who made quite a stink for many years during the War of Terror, saying that today's veterans are weak because her husband's a Vietnam vet and he didn't get PTSD. But all these veterans today are getting PTSD. No, we just know more, right? We know we're
Right.
talking about it. This generation is much more open to talk about it. It's the same with the autism spectrum, I believe. It's like we know more than we did and we can talk about it. And I think modern society offers them more. As a family member of a child with it, we discovered very early that if you gave them a blank piece of paper and a pencil, forget it, man. Nothing was happening. Right? Like when we had a teacher come to us and enraged, like your child is defiant. Like, what do you mean? I gave them a test and they just sat there stares like you gave my child, they have an IEP, and sure enough, we turned out when you give them a keyboard, whoop,
Yeah.
that's all it's
Right.
got
Right.
because they had
Yeah.
grown up on keyboards at that point, at the age of 2 nowadays. But
Yeah.
a pencil, no, but give him a keyboard, which was one of his IEP special things. No
Yeah.
problem. First
Right.
first to get done with his essays then. And that's what modern society offers. One of the keys we found with our family member was Xbox. And I've told the story before,
Mm.
when, that not having to face somebody, look them in the face, but being on an Xbox talking to a stranger, opened them up. That way and so it frustrates me as a family member to see this kind of stuff. It must frustrate you as a doctor because the science is being misinterpreted here. It's being completely shunned, isn't it?
Absolutely, because I mean, I see kids and adults on the spectrum all the time, all the way from severely disabled people who are nonverbal, but still have value, right?
Yeah.
Like it's offensive even for the people who may fit that little narrow characterization that he described there, as if these are people without value and these are people to be discarded and not to be welcomed into society. These are full people who are loved by their families and should be treated like full people. They just have a different way of processing things. But all the way down to folks who we used to call Asperger's, who are more mild on the spectrum, who just maybe have and a lot come in with mental health disorders and tough time in school, right? Interacting with other kids or with teachers or being what they call defiant. Um, yeah, I think it can't be overstated how dangerous it is, how cruel it is. He should just step up and apologize. He shouldn't have all his crazy views, but he can hold on to those if he wants. I mean, that's not going to change. But just to come on and say, "Hey, man, I didn't mean to state that these kids are garbage. These kids aren't worthwhile." Um, and just leave it at that. But I think mea culpa doesn't seem to be a thing these folks do, right?
Well, it's not the
But
Republican thing. Oh,
yeah.
I got a perfect that's a perfect place to take a short break. I wanna go to we have a great sponsor this week. Let's take a short pause. Our sponsors will come right back. Hey guys, 420 is around the corner, and there's no better time to elevate your wellness routine, whether you want to relax, recharge, or refocus with Via as the perfect liner for you. I know it probably doesn't seem like I'm the most usual guy who would be worried about 420 or using gummies and other products, but I gotta tell you, I'm very fortunate to have Via as a sponsor and use these products. My favorite is right here, the Elevate. Helps me get my mood up when I'm having a rough day. You guys know it has been a bouncy few months in America and everywhere, and I'm really proud to have Via products as part of my routine. I can use them when I need to help focus, when I elevate my mood, or frankly, when I just want to relax at night. Their products are perfect for that. And if you haven't tried them yet, you're seriously missing out. Whether you need to unwind, refocus, or boost your mood, Via is here to enhance your everyday and, frankly, for me, some long nights as well. They're trusted by over 500,000 happy customers, and Via is changing the game in natural wellness, blending powerful, high-quality hemp-driven ingredients to deliver real effect-driven benefits. Whether you're looking to sleep better or have a better libido or, improve your focus like me because I'm a mess, or you just want to simply relax, Via has tailored products just for you with they range from 0 to high cannabinoid levels. Via lets you fully customize your experience to fit your needs. We're looking to support your daily wellness routine. As I mentioned, enhance your focus or clarity. These are award-winning effect forward gummies to calming drops. And the best part for me is that Via legally ships across the USA. It's discreet, it's direct to your door. There's no medical card required. It's backed by a worry-free guarantee. Now, if you're 21 if you're 21 years old and up, you could treat yourself to Via's annual Spring 420 sale. Black Friday level savings, folks, up to 35% site wide right now, up to 50% off packs and bundles, and get a free gift and more savings with your first order order using our exclusive code right here for the show. That's Fred at the link in our description. Plus, enjoy free shipping on orders over $100. So use Fred at the code right here on the website now right here on screen. That's Fred Fred at the link in the description. Enjoy free shipping on orders over $100. You'll get more savings, more gifts. Take advantage of the spring 420 sale from our great sponsor, Via. Thanks. And we're back. So shifting from that, from the autism, from the vaccines, like let's go to the HHS side. And I'm a Harvard alum. You have to say that every show. It's just the rule.
There you go. Well, now Harvard's
Well, that's it. So I think that the Daily Show did a bit like, I think the Daily. I said all my friends from my grad school started saying that bit around it. But for those who know, this week the Daily Show did a bit like it gives everybody on TV a chance to say they went to Harvard. But having said that, I was very proud of them to see them stand up to this and fight back. And obviously, they've got a huge endowment; they have more power than other universities. But these cuts to research, these cuts to medical science, this is incredibly. I mean, I think I'll probably call this show, a return to the dark ages. It almost feels like we're going that way because can you explain to our viewers just how important this government partnership is in medical research at the universities level and everywhere else, and how dangerous this is?
critically important. We actually had a guest, a guest on our podcast today from the director of the university's Allied for Essential Medicines. And essentially, they started in 2001 at Yale, sorry, at Yale, but Harvard's part of it, a lot of universities. And they recognize that, hey, there's these drugs that we were instrumental in developing are now being taken over by big pharmaceutical companies, and they're making billions of dollars, and patients can't afford them. And so we think we should have a voice in how the patents work on drugs that we develop using government funding, NIH funding. And something like 90% of drugs out there on the market have a material basis in university, NIH funded basic science research, or they wouldn't be there in the first place. And so on the side of big pharma and raking in billions and the executive order he did that is going to enrich big pharma. That's another thing they're doing to make people's lives worse from a healthcare point of view. But when you look at them, doging NIH and cutting off funding to these places, or just doing it because they don't like some classes they teach or professors or students they allowed to be at their schools, we're going to have dramatic impact. But the problem is, it's like one of those things you don't know good public health when it's happening because bad things don't happen and you don't recognize it. People aren't going to necessarily know the things that weren't developed because they won't be there, but we will be worse off. If this had happened 20, 30 years ago to this extent, drugs for Parkinson's, Parkinson's disease, sorry, drugs for Alzheimer's, diabetes, everything, they would be severely curtailed. Cancer treatment. Some cancers now are, HIV. My God, the amount of federal government funded research that went into making HIV a chronic disease rather than a death sentence, in about 30, 40 years, that all goes away. Incredibly dangerous, incredibly stupid. It's a brain drain from this country. The best and the brightest are not going to want to come here, but also aren't going to want to stay here. I mean, even students here in the US of A who want to stay here and study at universities like Harvard and otherwise, if there are opportunities to do the latest cutting edge research, guess what? They're going to find it somewhere else, and we're going to be the worst for it. And again, them making things great is this kind of, like you said, reversion to the dark ages, and that's another proof point that that's what they're after.
And they're losing thousands of eternal. I mean, and that's the other thing I worry about too. I know you are in you're an ER physician. These are also departments that worry about disease outbreaks. I mean, I saw a story this week. I'm probably sure you saw it too. I think it was in Ohio. I think it was Cincinnati, where they look at they had lead poisoning in the water,
Yeah.
and they called the CDC, right? And there's an organization that comes out and does that assessment. They fired everybody. They
Yeah.
they fired they fired the entire department that handles lead poisoning in water. I mean, it to save money. I don't understand what kind of money you're saving when kids are dying from bad water. And it's hard not to believe it's just because it's the wrong kids that are dying, right? It's you know what I mean? It's not having it in the nice schools. It's not the private schools that have lead pipes, is it?
Well, yeah, I mean, I'm here in Michigan, right? Flint, Michigan.
Right.
We all lived through that. Dr. Monahana Atisha and her team that kind of drew that out, and the Republican administration of Governor Rick Snyder, and how they, to save $50,000, switched the water supply and poisoned all those kids. And the thing about lead poisoning, I mean, it's so insidious. You have decreased educational attainment. These kids, increased rates of ADD, ADHD, increased rates of incarceration in communities with higher lead levels. I mean, we're having such a generational effect of this, and it impacts entire communities, right? Not just individuals or families, entire communities. And most of these communities are Black or brown communities. And we can draw inference, if you want, of how the administration feels about those communities, perhaps, relative to other communities. And this
Right.
obviously isn't a priority on their radar, because they've abandoned those folks.
Well, when the first thing gets, the callback of them all, right? The very first statement, well, the first video we watched the show, they're not going to be taxpayers. There is a belief. It is clear that they've taken this belief that certain members of our society are burdens on said society to the healthcare of our country, which is a very, very dangerous direction, isn't it? I mean, again, we're one step away from some really dark stuff, aren't we?
Yeah, yeah, and I hope it's more than a step, or maybe one big step. But yeah, it
Yeah.
just feels like we're kind of on the precipice of something pretty bad. I mean, I will say, the regular people kind of working every day in healthcare, in all aspects of society, are still like doing the work, right? I can say definitively, as healthcare professionals, are not going to abandon our patients and go down this path with RFK Jr. But
Yeah.
so much of what we're able to do, we can do one offs, and we can do it. We need institutional support. We need government support, to be able to do it the most effectively. Emergency medicine, I love it. It's my career. It's not the most efficient way to manage disease in a community. We need people not to end up in the ER, when they have preventative diseases like measles, or don't get poisoned with lead. That's definitely preferable, if we can head that off before they end up, having some kind of a crisis that we got to deal with.
Yeah, and I guess the punchline of this whole conversation, and I'll let you go. I know you got a hard stop. Is the kid we were talking about earlier, who I've dealt with and on the spectrum, is working in an ER room.
Yeah.
He's working in the ER right now
Oh,
as
that's great.
he's staff in an ER. So again,
That's great.
certainly not a burden on society. And one of the reasons that he's apparently succeeding in this new line of work is he can stand in the emergency room and everybody's losing their head. Guess what?
Yeah.
You know,
Yeah.
he's a cool cucumber. You can sit there when people are dying and say, "Okay, what was that note, doc?" Well, again, it's
Wow.
these are
Yeah.
superpowers. These are superpowers, and even in your ear
Sure.
industry too. So, well, so where can
Absolutely.
they find? I mean, there's a lot to find. You got new podcasts. I
Yeah.
think I've of course you're at the committee for the committee to protect healthcare at committee to protect.org. Where else can they
Yeah.
find you?
Yeah, committeedtruck.org. That's the work we're doing in advocacy, kind of now nearly 40,000 docs around the country advocating for
Wow.
co-patient policies to decrease costs, increase access. And then the podcast, Caging America, it's going to be on all the platforms: Spotify, Apple Podcasts. We'll be doing clips on YouTube, eventually publishing on YouTube. New to the game, but folks like you who are out there doing it right, it's nice to have good examples out there of how we do this. And hopefully we could just have some good conversations like this one today.
I love it. Welcome, welcome. I'm glad to hear it. We need to have that conversation. The nation needs it more than ever. So I'm thrilled you're stepping up and join the fray. We need more
Yeah.
middle aged white guys with podcasts. Clearly,
Yeah. So
Obviously.
yes, yes.
And
Very
I'm the old man on the
understood,
Midas Touch.
understood.
I
Yeah.
think I'm the old man of the Midas Touch network. I'm the oldest one. So on their
I'm
Gen
the
X.
oldest one on every Zoom call I'm on, and there are references that these.
We can do it, man. Old dog with new
Yeah.
tricks. We're here. We're still here. Well, good talking to our old dog, Doc. I really appreciate you, Rob, and taking time for us. And I'm just thrilled we were able to. It's perfect timing with all the stuff craziness. And keep in touch. We'll have to get you back. You may be my resident doc, whether you like it or not.
There you go. Oh, anytime. Glad to be here.
Great talking to you. We'll see you soon.
Okay.
Great conversation. Great conversation. I really enjoy talking to Dr. Davidson. Look, this is a very dangerous time, and it really is a return to the dark ages in a lot of ways, and should scare us. And we have to use our voices. Matter of fact, I will be speaking in St. Louis tomorrow, Saturday morning at Keener Plaza. I'll be speaking. Ironically, the March to Defend Science, with a lot of the students from the local universities will be turning out for that. They've asked me to give a pep talk at the beginning. So if you're in St. Louis tomorrow, Saturday around, I think it's, I want to say noon or 11. I should look that. I should probably know that. I think it's 11 at Keener Plaza. We'll be there. And across the country, April 19th, there'll be a number of protests about defending science. And of course, the big one I'm doing right now, and you may have heard it, I probably should the show before, but I'm really excited about the fact that we will be veterans will be marching on Washington. If you remember the bonus army from 1932, we're not going to quite that far, but we will be bringing thousands of veterans to Washington, D.C. on June 6th, D-Day. Friday, June 6th in the afternoon, we'll be on the National Mall with thousands of our veterans, thousands of supporters and allies as we fight back against the stripping of our rights and benefits, stripping of our democracy, firing of so many veterans from their government positions for no reason other than to fake save money. So it's uniteforveterans.org. I'd love you to go there, especially if you're a veteran or a supporter. If you're going to be coming or you just want more information about what we're doing, you can sign up for our email. It's unite4veterans.org right here on the screen. I'd love you to go there as soon as possible. Sign up. Let us know you're going to be there. We have a huge announcement next week. I can't even tell you, I can't give any of it away, but an amazing, I'll tell you, a band has come to us, and it's effing incredible. So keep watch my social media channels. As you know, of course, you can always find me. I'm very busy on Blue Sky. I'm still hanging in there on Twitter at Wellman. Of course, my Instagram and all. And of course, as always, I got to push it every week. I got to tell you the big, exciting news. Next, join us this weekend, every weekend at the On Democracy channel, everywhere. We will be on this weekend, all and every Sunday. It's now called Too Late to Cancel. I got the wrong buttons. Our show, Too Late to Cancel, every Sunday at 11 a.m. Eastern and 8 a.m. Pacific. That is Too Late to Cancel. It's our Sunday show. We had a great time. Matter of fact, we have a minute. I want to show you a clip. This is an amazing. If you've never seen the show, this is a perfect example of what I'm talking about. This is the panel we had this weekend as our premiere show of Too Late to Cancel. And I had two amazing people on this show. You'll see, and here's the conversation we had in the panel about panel picks. But this is one you should watch. I want to show you this clip if you'll indulge me.
We love left field, left field. No, there are some little like perks to having like when you have it too. You can do no wrong. Like when I especially all 3 times I had it, it's a get out of jail free card for anything. Morning meeting. I have cancer. Literally, what are you gonna say? No, we really need you in this 8 a.m. Zoom. I have cancer. So it's my 3rd time having cancer. I could get out of it is the ultimate get out of jail free card. And so I highly recommend it. Yeah, no, like there's literally no, I could oh, it looks so good. You can just you can let yourself go, like gain 5-10 pounds. People are like, what happened? I'm like, cancer, actually.
Answer. Yeah.
Cancer.
You could go to
I'm using that. I don't have
I need to be at the front of every line because
Yes,
Cancer.
I could cut in front of the Make-A-Wish kids. I have cancer too. Sorry. Is it your 3rd time? Is it your 3rd time?
Well, that's the thing. He could. So that's Alex Cumin, the comedian who, believe it or not, had thyroid cancer 3 times and survived. She's now been clean for 2 years. But you can see in the panel picks, we throw some questions up, and she does some bits about the upside of cancer, and so that's why I put that in there. And you can see how that goes. That's the panel from the show. We usually have comedians. We have some amazing. Steve Hofstetter is going to join the show in the coming weeks. People actors, And so if you haven't seen the Sunday show, again, that's every Sunday right on the On Democracy channel and my Substacks. That's Too Late to Cancel. I would love to see you there. With that, we've talked for a while. Obviously, the fight goes on, and there are protests going. There's a lot going on. I beg you, I implore you, make your voice heard. Stand out, stand up. We are not done. And if we fight back against these tyrannies, these outrageous acts like RFK Jr.'s outrageous attacks on science, Trump's attacks on universities. We can win, and we will win if we stand together. So again, I'm Fred Wellman, host of Optimize FP1 right here on the MeidasTouch Network. I can't wait to see you again next week. Thanks for joining us.